So you bring your baby home from the NICU, your baby is thriving, they're eating well, they're starting to meet their milestones, they are catching up and meeting everything that they should. And then you get a phone call like, oh, you've got an eye clinic appointment, you need to be here at this time. Maybe depending on the eye clinic, maybe you need to go pick up some eye drops and they want you to put the eye drops in. It seems confusing because you thought you were done with it. They had their eye exams done in the NICU and maybe you figured that's it. That's all you need to get done. And maybe even when the ophthalmologist saw your baby in the NICU, they told you everything was fine. So doesn't that mean you don't need to see your baby anymore? Well, there's a couple different follow-up appointments that we need to do. And it's important to just ensure that your baby's vision is developing fine. So first, even if your baby was discharged from the hospital, if the retina is not fully mature, and if you haven't listened to, you can go ahead and listen to my episode on retinopathy of prematurity. If the ophthalmologist did not say, yep, the retina is fully mature, meaning like all the blood vessels have grown out to the periphery, you're good, that means we still have to continue follow-up even as an outpatient. We still have to watch and record these blood vessels. Everything might be fine and we don't see any abnormal blood vessels, but I still need to watch them until they grow out. So you might have visits as soon as you're discharged, within a week, and we have to keep watching until the blood vessels are fully mature. Now, let's say I came and I saw you, or your ophthalmologist came and saw you in the NICU and they said, yep, everything is fine, mature vascularization. That always feels like the baby is graduating. I love it. I love being able to write that on the chart, mature vascularization. I put a little smiley face on it too. And it just feels like a milestone. You don't need to come right away, but you still need to see me in 6 months. And the reason for that is even with just any premature baby, even if they did not have retinopathy premature, if they didn't even have those abnormal blood vessels or they didn't need laser treatment, which of course, if they had those or they needed a VEGF treatment, anti-VEGF treatment, or a laser treatment, then you absolutely need to be maintaining closer follow-up with me. But let's say everything was good, you still need to come in 6 months. And the reason is preemie babies are just at higher risk for developing vision and strabismus problems. That's just been shown. And at the 6 month mark, we're doing a lot of different checks that your pediatrician is not doing in such great detail to make sure that your baby is on the path for good vision, because that's of course what we all want. So even full-term babies, their visual system is not fully developed. It takes time for the visual system to develop in a baby up until about age 2. You've always heard, initially a baby's like 20/800, or they can only see black and white shapes. And I've got a full podcast episode on the exact milestones that babies see. But even term babies born at 38 or 40 weeks, their visual system is still developing. And then added onto that a layer of prematurity, a little bit further behind in terms of the visual development. So this is something that we really just want to make sure that things are hitting where they need to. So the few problems that we're worried about: farsightedness or hyperopia, strabismus, which is misalignment of the eyes, and amblyopia. That's when the vision in one eye is worse than the vision in the other. And like, how can you tell that what a baby's vision is? We do all these measurements, and that's why you've got to come in at the 6 month mark. This is different than what the pediatrician can check. Obviously, the pediatrician cannot tell you what your baby's vision is at 6 months, but we're looking for certain things, and that's what I want to review now so that you feel comfortable. All right, this appointment is necessary, and then also are armed with the questions that you can ask your ophthalmologist. Probably you're seeing a pediatric ophthalmologist to make sure that everything is going in the right direction. So one of the first things that I am checking for is something called delayed visual maturation. I tell parents, it's not like the vision is a light switch where all of a sudden, whoop, the vision just turns on and everything is good to go. It's more like a dimmer. It takes time to develop. Like I said, even for babies that are born full term, it takes time. And we just want to make sure that that progression is where it needs to be. But this is really the most common diagnosis that I see in premature babies. It just means that the vision is just lagging behind just a little bit. And likely your pediatrician is telling you as well that the developmental milestones, the other milestones that you're watching for your baby, just a little bit behind. Usually they say by about age 2 that preemie babies have caught up to where they need to be. And it's kind of the same thing with the vision, but it doesn't take till age 2. Usually we're going to see in babies that they're starting to fix and follow. They're starting to watch and track objects and faces around that 3 to 6 month mark. But for preemie babies, again, that's going to be a little bit further behind. So what I'm looking for is I'm just checking to make sure the pupils are a normal size, that the pupils themselves, the black circles in the middle of the eye, react normally to light. And when I can check that, then we're also checking a lot of different other things. We need to make sure that your baby's able to track objects. That might be a concern for you. You might come home and think everything looked fine, but there's not looking at my face. Is that a problem? Is that something to worry about? And more often than not, it's not something to worry about. Your baby will catch up. This is that dimmer switch we're talking about. It's gradually every day as they receive more and more sensory input, things are going to improve. But it's something we need to watch. Really, it's just that the brain hasn't fully connected to the eyes. And just like they're learning to use their arms and their legs, they're learning to use their eye muscles and even their visual input. So for full-term babies, around 3 to 6 months, they're starting to track objects. You can show them a little thing, they'll track it. And then when you bring your baby home, you might not see that, and it can be concerning. This is just really more of a neurologic processing. We just need a little bit of extra time for your preemie baby to make those connections between the brain and the optic nerve pathways. That immaturity is just normal for premature babies, and it's not anything to be concerned about, but it follows a time course of its own, and that's something that we're watching out for. Now, most full-term babies, maybe 3 to 4 months is when you would see them track objects. So a premature baby adjusted age, remember this is adjusted age, usually we're going to see it at 3 to 6 months adjusted age. So not 3 to 6 months post-gestational age, but the adjusted age. So that's something also to be mindful of. You got to always look at what the adjusted age is for your baby and track those visual milestones the same way that you would track any other milestone that you're watching. Now, a lot of times it might seem like all of a sudden they respond. And one day they aren't seeing things, and then another they're actually tracking stimuli. And that can also be normal. That dimmer switch can get thrown on real quick. And there's nothing that you need to do. There's no eye exercises. You don't need to show them black and white objects. Just life in general, that visual input is enough. There's no glasses or surgery or medications, eye drops, or certain kinds of food or formula that you need. You just need to give it time, which can be hard. I'm not a patient person, but eventually the majority of these babies are going to develop normal visual responses. It just takes a couple months longer. So if your NICU baby is not engaging in a way that you think is normal or you're concerned, of course, let us know. And we can check to make sure that there's not anything else going on the inside of the eye. Now, the eye exam I do in the office at that 6-month mark, it is nothing like what I have to do when a baby is in the NICU. I do not need to put that lid speculum in the eye to keep the eyelid open because we don't need to check the periphery. I don't need to move the eyeball around with the little cotton tip applicator, the little Q-tip, or with the metal scleral depressor. So you don't have to worry about that. Usually at the 6-month mark, I just need to get a quick, brief look at the middle of the eye because we've already examined the eye very fully and in its entirety. And once the blood vessels are mature, you cannot get ROP again. Once they're mature, that's it. They're not going to ungrow. So you don't need to worry about that. I know it's a really common concern for parents. For more tips on eye health, parenting, and staying focused in a busy world, follow me on Instagram at Dr. Rupa Wong or head to drrupawong.com. Until next time, keep your vision clear, your priorities focused, and your family thriving.